Hello friends, welcome back to my channel. In this video, I am going to say about the clavipectoral fascia, its attachment and the structure piercing the clavipectoral fascia. Clavipectoral fascia is the one which extends from pectoralis minor to clavicle. It is a strong sheet of fascia which extends from pectoralis minor to clavicle called clavipectoral fascia. It encloses pectoralis minor and subclavius muscle. First, we'll see the attachment of clavipectoral fascia. It has medial attachment, lateral attachment, superior and inferior attachments are there. Medially, this clavipectoral fascia blends with anterior intercostal membrane and upper two intercostal space. Laterally, it fuses with the coracoid process and blends with coracoclavicular ligament. Above this fascia, it extends upwards and divides into two, that is, it splits into two, encloses subclavius muscle. This anterior and posterior lamina of this attached to the subclavian groove of clavicle. The fascia split into anterior and posterior lamina and which is attached to the subclavian groove of clavicle. So here the posterior lamina of this which is covering the subclavius, it blends with the axillary sheath and it anchors the inferior belly of omohyoid to the clavicle. This is the inferior belly of omohyoid and this helps this fascia which anchors the inferior belly of omohyoid to clavicle. This is the above attachment of clavipectoral fascia. Below this fascia which extends downwards and splits into two, encloses the pectoralis minor muscle. It then reunites in the lower border of the pectoralis minor and it is attached to the axillary fascia. And it's forming a suspensory ligament of axilla. This makes the hollow armpit. Then structure piercing the clavipectoral fascia. So this is the clavipectoral fascia. It is pierced by cephalic vein which opens into the axillary vein. And thoracoacromial artery. After piercing the clavipectoral fascia, the thoracoacromial artery divides into clavicular branch, pectoral branch, deltoid branch and acromial branch. Then lateral pectoral nerve and a few lymphatics which opens here, which opens into the apical group of the axillary lymph nodes. So these are the structure piercing the clavipectoral fascia. So now in the cut section you can see the vertical extent of clavipectoral fascia. This clavipectoral fascia in a vertical extent, it divides into two layers and encloses the subclavius muscle. So here the anterior and posterior lamina of this get into attached to the subclavian groove of clavicle. The posterior lamina of this blends with the investing layer of deep cervical fascia, giving a boundary to the supraclavicular space. So here the point where the splitting of this clavipectoral fascia into two layers and encloses the subclavius muscle node, that comes under infraclavicular space. So like this it is enclosing two spaces, supraclavicular space and infraclavicular space. So these are the important features about the clavipectoral fascia. Thank you friends. Thank you for watching this video. If you like this video, please share and subscribe. Don't forget to click the bell icon.